So we're going to continue on. So at this point, you would have your patient, and we've got our primary tubing. We've got the cap at the end of it. We're going to get his fluid started. So we're going to take this alcohol pad. You want to take the end of this, and remember, you want to squeeze it. We're going to clean it for 15 seconds. Okay, so say that was 15. Don't drop it. Don't let it touch the skin, because then you're going to have to re-clean it again. So kind of hold it between your fingers. Pop the cap off. And then you're going to connect it into here. Push and twist at the same time. Remember to undo your clamp. We've undone our clamp here. And this is where you would program your pump to infuse. Okay? And we'll show you that in the lab. So right now, I'm going to go ahead and clamp this. I'm going to disconnect him. Anytime you disconnect a primary tubing, you don't want to ever leave this open, because then you'll contaminate the whole system and you'll have to replace it. But I don't have a cap right now, so just know that you would do that. So say they're being discharged today and you need to take out the IV. So we want to make sure that this is one of the last things that we do before they leave the hospital, because just in case something ever happens, you've still got a way to get them medication and to help them, okay? So we're going to pretend like this is a 2x2. We've got our tape. Just kind of start that. Clamped it off. Corners here, it can be really sticky on the skin, especially on these fake arms. So we're going to do the best we can. But you got, anytime that there's a possibility of you coming into contact with blood, you want to have gloves on. So we want to pull to the center, towards where you access the vein. Okay? You peel it up like this. You want to support the skin. Get our tape all undone. Another thing, if you got a person with hairy arms or something and you're trying to put an IV in, you don't want to ever shave the area. You want to clip the skin. That way your Tegaderm will stick and keep it clean. So we're going, kind of rolling everything in. Okay? All right. So you want to make sure, and when you take this out, you've got pressure on that insertion site, because it might bleed. They might maybe on blood thinners or something. So I make it into a square like that. Got my tape ready. I've pulled all this down. And you're going to take all of this out in one swift move. So I've got my 2x2. And I just put it over there. You want to note the end of your catheter. This is something that you need to document. Catheter tip intact. Okay? Make sure you document it. You can throw that away in the trash can. So here, I've got pressure. I'll get me a piece of tape. Sticky, sticky. You want to make sure, if you'll pull the tape a little bit, that's really tight and it puts pressure on there. So you want to hold pressure for a couple minutes. They can hold pressure while you're doing other things, but you want to make sure that that doesn't bleed everywhere and it's got that pressure on there. And then you would take your gloves off, do hand hygiene, and then there you go. That's it.